Hi everyone, my name is Strong. I'm the CEO of Zopac Medical. This video is to share our knowledge of coronavirus and explain why all of us Americans need to work together in order to fight this disease and save lives. So our company sells a mask that's N95, and that's why we've been working on fighting coronavirus with our customers since middle of January. And we want to share our messages that's simple and easy to understand. I think it's very important to understand what's happening everywhere in America, why is everything shutting down. So once we understand why, then we can do things to help. On March 11th, I had a company meeting and interviewed a professor from one of the best engineering college in China. And we wanted to know exactly what's going on over there from the information directly from China. The first question was, why is coronavirus so dangerous? And the answer is that coronavirus is dangerous because it spreads easily. And the most important thing is that the carriers start transmitting the disease without any symptoms. Virus outbreak like SARS, the patients were not contagious until they have symptoms. For coronavirus, somebody with coronavirus may not show symptoms for up to 2 weeks, and by then they're not wearing masks, other people are not wearing masks, and it spreads easily through airborne, and lots and lots of people could have coronavirus before this person shows any symptoms. That's why it's so dangerous. Number two, what is the age correlation of death for coronavirus? Almost no one died in China under the age of 60 with proper treatment. The people above the age of 60 have weaker immune system and are at higher risk, especially for people with immune suppression and lung diseases like COPD, they are at higher risk. Number three, what does coronavirus do to people? Coronavirus attacks the lungs. It causes the lungs to shut down, and that's why it's a deadly disease. Number four, most people recover from coronavirus, so how does China treat the patients? Because we're wondering, our hospital needs to know how to treat. Otherwise, there's no point going to the hospital. So the answer is there's no antiviral medication or vaccine for coronavirus in China. It purely depends on the patient's immune system to fight off the disease. They use a combination of Chinese medicine and Western medicine for treatment. The key is to keep the lungs function long enough for the patient's immune system to fight off the virus. It's a pure race. The problem is we have a harder time to keep lungs functioning for people above the age of 60 and very difficult for age of 70. And that's why they are at higher risk. So next, how is the situation in China right now? So last month I was talking to him on the phone. His family was restricted from going outside. Every 2 days, only one adult can go out for a couple hours for grocery shopping. And that was it. Now, he says, it's almost back to normal. Everyone is back to work, including factories. My family was only allowed to have one adult person leave the house every 2 days for a few hours for grocery shopping. Now adults can go out without restriction, but children can only go out with adults. The malls, restaurants, school, university are still closed. School is estimated to be open again on April 1st, not confirmed yet. So right now, this video is taken, right now I'm talking on March 14th, 2020. What is the key thing China did to stabilize the country against coronavirus pandemic? And he said the most important thing was everyone is required by law to wear a mask in public. Shutting down everything to prevent people interactions and quarantine the sick people are critical too. However, the number one most important thing to prevent new cases was that everyone is required by law in China to wear a mask in public. So in the US, we're told that not to wear a mask if you're healthy. Mask is only for sick people to wear so they don't transmit diseases. And are you saying that's not the message in China? And he said, yes, that is totally the opposite. You have to wear a mask, and everyone must wear a mask in order to stop the threat, the spread of coronavirus. Coronavirus is mainly transmitted by airborne particles. That is why it spreads so quickly. You have to cover your nose and mouth, otherwise it's directly entry to the respiratory system. Everyone must wear a mask. It doesn't work if only some people wear it. The people don't wear it will still spread the virus. So then we asked, well, how did China provide 1.6 billion people with N95 masks? In the US, we have a shortage of masks, and we only have 330 million people. The answer is that the law does not require to wear an N95 mask, just any mask. N95 mask is better, but any mask will work that covers the nose and the mouth. The airborne particles are normally in a liquid mist. In air, any mask that will absorb moisture is good, and it is working there in China. The most important thing is to cover nose and mouth. Anything is better than nothing at all. Anything covering the nose and mouth is better than direct entry with no obstruction at all. And he said that you can also make something at home to cover your nose and mouth, even with a towel and with elastic bands, and otherwise the virus can just go straight in the respiratory system. And the coronavirus loves the lungs. He gets free masks from work and have 100 masks at home. They're not N95, and he used one, reused them for a week, then he throws it away. Next question, do you guys wear gloves too? We're told just wash your hands, cough in our arms, and so do you wear gloves to protect transmission by touching things? And he says, no, we don't wear gloves, just a mask. Coronavirus is mainly transmitted by airborne particles, and that is why it transmits so easily. You should wash your hands, but that is not going to stop the spread. In other words, you can be washing your hands, and somebody else next to you has coronavirus with no symptoms, and he's not wearing a mask, you're not wearing a mask, and you're both washing hands, and you can get coronavirus from that person just because you're not wearing a mask and he's not wearing a mask. Does that make sense? So with that learning, there's some simple definitions. People need to understand what is a virus. A virus is a living organism that have to have a host. It lives in cells and it replicates quickly. And essentially it infects, so the body has fever trying to fight off the virus, and it creates disease. In this case, coronavirus likes to attack the lung cells. So what is N95? Some people have never even heard of N95. Now we specifically talked about anything is better than nothing. So you don't have to have an N95 mask. I'm saying that even though my company only sells N95 masks, but this is about saving lives. This is not about my business. So N95 means a certificate from CDC and NIOSH, so Center of Disease Prevention, Control and Prevention, that it will filter out at least minimum 95% of aerosol or liquid or solid particles in the air down to a minimum of 0.3 micron. That is what N95 is all about. The virus is in a host. It comes out from a sick person's mouth or nose, and it is suspending the air as an airborne. And almost all of it is greater than 0.3 microns. So N95 protects against all types of virus infection, but it's 95 efficiency. I mean, nothing is perfect, but any mask protecting, covering nose and mouth is better than nothing, right? Something comes, I have nothing, it comes straight into my mouth, versus I have a mask, I have a cotton, I have whatever, that at least it has to penetrate through. A mask is a mechanical filtration, a mechanical blockage. The message is we have to cover our nose and mouth, and in order to prevent the pandemic from spreading, everyone must wear a mask or something covering nose and mouth, and it does not have to be N95 in public. Now, N95 is better protection. I do recommend it for people age 60 and above to wear N95 mask. But then for children, you know, I have 3 kids, and 1, 4, and 13. I worry about them. Their lives are more important than mine. And so I don't have a N95 mask that fits children, that's completely sealed. And so I don't want just any mask that can leak on the sides. This is not a sawdust I'm trying to protect. This is not a sheetrock powder I'm trying to prevent. This is a virus that I'm trying to protect. So then now I know I'm just going to cover their nose and mouth with, you know, with ski coverings or something. I can even make it with a towel with elastic bands, but something that covers their nose and mouth. And I just did that for my kids, and I think that if you can't find a mask, you can make something at home for your kids as well. So America, why are things shutting down? So it's been a month, 2 months, and our government is the only government in the world that tells people, don't buy a mask if you're healthy, don't wear a mask if you're healthy, and if it's not fit properly, that you have increased chance of getting the coronavirus. Well, if you think logically, if you take a 3M disposable mask, what's there to fit? It has no adjustment knobs. You put it over your ear, elastic bands, and you pop it on. If it's off center, you center it. There is no knobs, or an expert engineer like me can come to you and say, hey, you know, you turn this knob or that, I can't even change the shape. Well, if that's the truth, is that don't wear it just because fitting, why not create a fitting video that everybody can see? Because it's not a rocket science to put on that 3M disposable mask. Okay? So, you know, the thing is that we need proper knowledge to our people to protect ourselves. And the common sense is that the main route is airborne. So wear a mask will protect you. It's much better than nothing, right? So then why is everything shutting down? That's because almost nobody wears a mask here in the United States. If you start looking at pictures in South Korea, Taiwan, China, places that's starting to have lower cases and controlling, everybody is wearing a mask. Everybody. So because no one has been wearing masks, and the people who are contagious, they are not self-quarantined because they don't even have symptoms. They're not wearing masks because they have no symptoms, because we're told if you're healthy, don't wear a mask, don't get a mask, don't buy a mask. So it's been passing for over a month and a half. And payroll tax cut, travel ban, waiving student loan interest, you know, all of these things, yeah, they're nice things, but putting more money in Americans' pocket is good for stimulus for an economy that people don't have money and cannot spend. But people are not spending money. It's because there's a virus going around. It has nothing to do with that people don't have money. And to save the economy and save this country is we gotta contain and stop the spreading of coronavirus so that it's safe for everybody to go out. And these measures, bailout, of cruise line bailout, of airline telling people it's safe to travel on air even though it's enclosed area because it has HEPA filters. No, somebody can sit next to you with coronavirus and sneeze on you. The virus doesn't go up and it goes through the HEPA filter or wherever the HEPA filter is before it comes to you. If the person sits next to you and talking to you, and you can have the virus because you are in an enclosed area and close proximity. So it's very, very important that we protect this country and also our loved ones and also people we don't know with be responsible, wear a mask, so then that's the only way we can stop the spread of coronavirus. Now, things are shutting down is because probably we have more than 1 million people that contracted the virus in the last 2 months because it's exponential. If one person have it and pass to, 50, 60 people, and those people pass to 50, 60 people in 2 weeks' time, that's super quick. And the reason why we don't have that many cases is because only around 5,000 people have been tested in the country so far, and we have 1,500 confirmed cases. Well, that's a pretty high percentage. So the other thing is that the death rate for people age 60 and above is a more accurate number to understand than the 2.5% from global population. Because if you, under age of 60, almost nobody died. If you take those numbers and combine into the group with people dying above 60, then it's going to shrink that number. So once you take that group under 60 out, just the age 60 and above, with proper treatment, the death rate could be up to like 15%. Now, when the pandemic is going so strong and when we have too many people that exceeds our hospital capacity and people are not getting proper treatment, the death toll above 60 years old or above 70 years old could be much, much higher. Above 70, 80 years old can go up to maybe as high as 50 to 80% if they are not able to get treatment because hospital is full. So the only way we can prevent that is prevent the spread now by everybody wearing a mask against the culture we have. Don't make fun of people who wear a mask so we can save this country, save lives. And if you're young and you say, oh, I'm under age 60, I'm not gonna die, so I'm not gonna wear a mask, well, that is being very irresponsible because you can contract the virus, you might have a fever, and then you get well, you're done, but in the meantime, you didn't have symptoms, and you passed down to 15 people age 60 and above, and 3 of them died. Well, that's not okay. That is totally not okay. So I think I'm gonna wrap it up now. It's just that I talked about protecting kids with, doesn't have to be N95 mask. It could be anything covering their nose and mouth. I talk about that you don't have to have N95, even for adults. Just something cover your nose and mouth. I talked about that over age of 60, I do recommend, especially if you have immune suppression disease or COPD or already any kind of cardiopulmonary diseases, you should wear N95 just to have additional protection. That's all. So I hope this video helps and people will work together. All Americans needs to work together to fight this issue. It's not political. It's very important to remove politics from fighting coronavirus because it's very simple. A virus does not belong to any political party. It doesn't know. It doesn't care about political party. It will attack anyone. And this is the time for Americans, for us to unite in one and everybody work together to save this country and save lives. So let's put on masks when we go outside. This is my mask. shoulder bumps, and save lives.